Wow, dreams do come true. Basic salary 32,740, rural allowance 7,200 rand. Hey guys, welcome to the village. My name is Boni. I create content around careers, education with a dose of reality check. Today we have a video on health sciences. We have a doctor, we have a clinical psychologist, a radiographer, and a medical technologist. Yo guys, I am tired, but you know what? I told myself I just want to try something and do it consistently for 1 year, because I had a habit of not finishing things. Like starting something, if it gets difficult, and then I leave it. I just wanted to do this YouTube thing for 1 year and be consistent, post 2 videos per week. And yeah, just see what I can do, what I'm capable of. And of course, I am doing this all by myself. Let's start with a medical technologist. I did publish a video of a medical technologist, another medical technologist recently. So I saw your payslip of a biomedical technologist. I thought I should share mine, as a lot of people don't know much about this profession. There's a lot of money in it, but it's an okay salary to live on. She's saying there isn't. There isn't a lot of money on it, but yeah, it's a okay salary. I work in a private lab in the Western Cape. Yeah, one is a bit more with overtime, and there's another one with just less overtime. Okay, they have 5 years of working experience. So let's see payslip number 1. Basic salary 32,398, overtime 46 units. I'm assuming there's 46 hours. 12,894. Sunday time 1,000 rands. And then there is health grant 1,400, shift allowance 7,521, and then there's another overtime 7,000. Yo, these people, they stay at work. 7,942. Okay, total earnings for this month 66,214. Tax paid 15,396. And then total deductions 18,000, and a net pay of 48,211. Okay, let's see the second pay slip, what it has for us. So for this one, then the gross earnings is 66,000. Okay, this one is slightly lower. Yeah, but the total earnings is 40,453. Total deductions 13,293, and a net pay of 37,160. Okay, that's a medical technologist. Now let's go to a radiographer. Hi Boni, this is a payslip of a radiographer with 21 years of experience, holding a position as an assistant director radiographer, second highest position in the career of radiography. Working at a regional hospital in KwaZulu-Natal. Yo guys, I wonder how often can we get these positions. Is it one of those where someone needs to retire or pass away, God forbid, just to retire? Basic salary 56,481, and then there is overtime and housing allowance 1.6, and then there's a shift allowance 1,856, and then in hospital area, all meals 6,777 for meals. Okay, right, so let's see gross salary 70,618, and deductions of 30,916, and a net pay of 39,701. Tax is 20,240, and pension fund is 4,236. Gems, they are paying 4,100, and then they have other like policies and stuff. But yeah, the deductions are 30,916, and a net pay of 39,701. Guys, please don't forget to consider subscribing if you haven't already, and to like and share this video if you find value in it. Okay, let's go to a doctor's payslip. Boni, my childhood dream was to become a doctor, but life had its own plans, In 2009, during grade 12, I applied to medical school, but I was rejected. I decided to study human physiology at the University of Cape Town. I graduated with a degree, but still wasn't accepted into medical school. Rather than giving up, I decided to enroll at the University of Joburg's program of nuclear medicine, also a 4-year degree. There, I found success and graduated with flying colors. Got a job, community service in Durban. This was a great opportunity for me to put my new skill set. I hated nuclear medicine with all my heart. Guys, what is nuclear medicine? But I had no option, okay? However, I was in for a surprise. Just 2 weeks before I was scheduled to start my ComServe, I got an offer letter from the University of Witwatersrand for medical school. Wow, dreams do come true. What? And then I dropped the ComServe. I got an offer letter from, I dropped the ComServe post without even thinking about it. Even though the pay was quite decent, I remember calling my sister and she told me to go for it, go be a doctor. Kind of guys, if you do nuclear medicine, are you not going to become a doctor? Anyway, okay, you let me know in the comments. I started my vet journey as a third-year student. I did my medicine degree for 4 years. I started my vet journey as a third-year student. I did my medicine degree for 4 years as I was accepted into the GEMP program. I graduated last year, December, in record time. Girl! This story is just to motivate someone. It's not always about money, but passion. Yes, money is important, but it wasn't the driving factor for me. I just wanted to be a doctor, even though I was rejected for 10 years straight from every medical school in the country. I never gave up. 2009 to 2019, and now I'm a doctor. Passion will always pave the way. Thank you so much for sharing this with us. Let's see your salary, get dokotela. Let's see how much you are getting. Oh, this is so inspirational, guys. Basic salary 32,740, rural allowance 7,200 rand, fixed overtime 17,413, NP cash allowance 14,000 rand. I work a dog. This ain't bad at all. Gross salary 71,388, total deductions are 21,000 rand, and in a pay of 50,271. This is good, eh? A house rent market 1,000 rand, so she's got some deductions. Taxes 19,461. This is not bad at all, doc. I don't know why you say it's not about money, because it is. I wonder how much we're going to earn as someone in nuclear medicine. Guys, please let us know if you know anything about nuclear medicine, okay? Let's move to the last pay slip, which is of a trainee clinical psychologist. Another one where we need all the motivation. You know what? Good things don't come easy. I don't want to say they come to those who wait. No. I think good things come to those who work for them, you know, and never give up and just keep on grinding, you know, because when we say good things come to those who wait, that might be misleading. I want to encourage my fellow BA and social sciences measuring in psychology not to give up. I'm currently busy with my master's in clinical psychology, so this year is my internship year. I know it's really hard getting where I am currently. They can tell you, of course, I can also tell you how hard it is. I know, but I plead with them. Their patients can be worth the while. Psychology is money, especially in private practice, depending on how you work, because we know it's a business. Please note that this pay I'm receiving is unstructured, so I'm getting it as it is after tax deduction. Other interns choose structured, meaning they might get less than this. Hey guys, we don't know what's the difference between structured and unstructured. What we know is our baby boy, our boy has something here. He's got the job. Let's see. Basic salary 37,632. Remember, this is an intern. NP cash allowance 16,128. Gross salary 53,760. Deductions 12,766. And a net pay of 40,940. The only deduction they have is the tax. Okay, you know what? I mean, I'm happy. I don't know how the village feels about it. Whoever was feeling discouraged, whether getting into medicine or maybe getting into masters, sometimes for psychology, sometimes I hear even for for honors, is quite difficult. I hope you were motivated. I hope you were encouraged. Guys, I will see you on the next one. Let me know what other pay slips or guests would like to see on this channel. You can also submit your own payslip, kaba.bonisile@gmail.com. Bye.